Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Treatment of renal cell carcinoma. Treatment of renal cell carcinoma depends upon whether the tumor is localized renal cell carcinoma or is it a generalized or advanced metastatic tumor. So, so the main treatment depends upon whether it is a localized renal cell carcinoma or is it a generalized or locally advanced renal cell carcinoma. First we will see localized renal cell carcinoma. For localized renal cell carcinoma, the treatment of choice is we can do open radical nephrectomy can be done. Chemotherapy and radiotherapy are not effective for the uh, renal cell carcinoma. Whereas if the patient has Stauffer's syndrome, if there is Stauffer's syndrome, then we should do radical nephrectomy is preferred if the patient has Stauffer's syndrome. For Stauffer's syndrome, radical nephrectomy is preferred. Then, if the patient has locally advanced malignancy or metastatic renal cell carcinoma, if the patient has locally advanced or metastatic carcinoma, we can do radical nephrectomy is done where you remove the entire kidney. Along with that, debulking is done for cytoreduction. So there are two things: localized you do open radical nephrectomy, in localized advanced or metastatic you do radical nephrectomy with debulking surgery.
thank you and thank you for watching.